Former AMA President Kerryn Phelps says the messaging to GPs around coronavirus has been shambolic. Is Dr Chris Higgins a victim of that poor messaging?
What is clear is that Dr Chris Higgins was caught up in this situation where there has been inconsistency in the messaging right from the beginning, but Dr Higgins acted in accordance with all the principles and guidelines that are out there at the moment when it comes to testing for COVID-19. He had symptoms of a mild cold, which had largely resolved by the time he went back to work Monday the 2nd. And then only on Thursday, many days later, did he test for COVID-19 out of a sense of duty perhaps, but to explore the possibility of whether or not, given what is we're now becoming clear that there are an increase in case numbers in US. But at the time when Dr Higgins was returning back from the US, the USA was not on the high or moderate risk of countries on the list. It still isn't as we speak today, and the testing guidelines still remain what they were then. So Dr Higgins did nothing wrong.
So could other doctors do the same thing then in that case?
So Dr Higgins acted appropriately and he made a judgment in good faith given the information he had at hand and the need and requirements of his patients, which I'd obviously not seen, had been waiting to see him on his return. So we really take that duty and that responsibility very seriously, and we really, in this case, was clearly an example where the doctor made an informed and a judgment decision in good faith.
So should the rules and the messages be changed then? Or will doctors continue to work through what they consider to be mild colds?
Clearly, if we need clear guidelines and very consistent guidelines, we shouldn't be having to second guess or change our mode of operation at a whim's notice.
So right now, do you feel like you've got those clear guidelines?
Well, certainly we've had a letter overnight from the Chief Medical Officer, and that's given us some more information about where we're going and what's happening. It's given us some more comfort about a level of increased supply of PPE, the protective personal equipment and masks. It's given us more comfort about where it is in the community and the next stages of what's required. But I still say to you today that this is moving so rapidly. And I know that the Chief Medical Officer, Dr Murphy, has indicated that he'll come out with twice weekly briefings now for GPs and webinars to boot. But we really need to up that ante. So, based on this letter, what changes for GPs in the same situation as Dr Higgins? So I think now, in light, not so much in light of the letter as much as in light of what's happened here, doctors will be very, very unsure and perhaps err on even more side of caution.
And should they?
Well, look, I think this is a situation where clearly this COVID-19 is in a state where there's still isolated community transmission. We're now with more than 95 countries on the list. I think it's only a matter of time before we see an escalation in the advice to that. But at the moment, acting with each doctor will have to make that call based on the current guidelines as they exist.
Is there pressure on doctors to work through what they consider to be a mild cold?
There's no redundancy in the system. If we take time off out of our clinics, there's not the backup that you can pull another GP into your place at a short notice. And patients do require ongoing care, do require ongoing management, especially those with chronic conditions and the elderly in our community. Now, of course, we're not suggesting that we put people at risk, but we've got to be very, very clear. If we're to be expected not to work through a sniffle, not to work through that, we'll make it very clear and we'll comply. But there's not that redundancy in the system.
But you're saying that hasn't been made clear. So nothing has actually changed after this case at all?
Well, except from the public commentary, every GP now is feeling particularly unsupported and not will not feel that they're not being given the due help they need in terms of being at the front line. Without us, the system will not function in terms of keeping the pressure off the emergency department and the public hospitals. We're an important part, an important cog in the response by governments and the authorities to managing containing this disease in the early phases.
A few people have made this point today online, and I'd love to get your reflections, that after the bushfire crisis, the government created what looked like an advertisement. They contested it's an advertisement, but about their response. We haven't seen the same kind of public health information advertisements or information about basic things like hand washing. Is that necessary now, and should that be happening?
I have particularly communicated in recent days especially the need for such messaging to be ramped up significantly. We need a strong, robust public health information campaign from everything from hand washing, cough etiquette, what to do if you've got a sniffle, what to do when and if we do move to social distancing, what is social distancing? These are all questions that the public need to have the right information in a number of different channels and format, because we've got people from non-English speaking backgrounds, we've got people that don't, particularly social media literate, and people who aren't. And so no one channel is going to work.
And is that currently not available?
That is, I believe that message is finally getting through, and I expect to see some ramping up in that department this week.
You understand that there will be an advertisement campaign, something?
I made the point very strongly on Friday, and I'm told that's all in train.
Okay. Should we be utilising telemedicine more and online medicine?
We believe, especially now in this situation, there is a very, very good case to be made to have telemedicine consults. What that will do is three things. Not only will it more efficiently and effectively use valuable GP time, but also where you have a relationship between doctor and patient, or the clinic and patient, be able to quickly and accurately determine which people need further treatment and not. Remembering that up to 80% or more of people who get COVID-19 will not need any health intervention at all. So if we can manage them at home and not have them to come into the busy waiting rooms, we're going to really reduce any potential for spread. And the third option is we're going to be ramping up a message now that that in the coming weeks the importance of influenza vaccination, and we want patients to come in and get their flu vaccine. But clearly, if they think that the waiting room is going to be full of patients with COVID-19, there's going to be a fear, a barrier to that. And that's why some doctors will now put their hand up, I believe, and have what they call their own dedicated, in inverted commas, fever clinic, where they will have two entrances and they'll have patients being able to self-select, so to keep the community reassured that at this point in time their primary care doctor is still their best option during this crisis.
If people are diagnosed, of course, they're being asked to self-quarantine, as we know. For casuals, for people who rely on an income, that's very difficult. Does the AMA have a view? Do you have a view on whether the government should be covering those costs so people can isolate and not spread this disease?
Clearly, that's an issue, particularly for the relevant ministers in government. But if you look at the flow-on impacts to a significant number of Australians who would be in casual jobs especially, and obviously those casual jobs are often low-paid jobs, the enforcement of having 2 weeks in self-isolation is going to be obviously putting a significant stress and pressure on an already overstretched budget. And clearly we've got to look at when it comes to resilience, we've seen the best of resilience espoused in the bushfire response. This is clearly going to test the mettle again. And unfortunately, the scenes we saw in supermarket aisles on the weekend is only a testament to the amount of stress, fear and anxiety that's out there. And having to...
So your instinct is that, yes, the government should step in
there? Look, I won't prescribe exactly what they should do, but there needs to be some understanding and some addressing of those situations exactly.
Is that something that people are saying they're concerned about when they go and speak to their doctors, that they feel like the self-quarantining is risky for them?
But look, early on now, we haven't had too many of those conversations yet. Obviously, with only 71 cases, or those 78 cases or then counting, confirmed, and clearly in terms of also the fact that those people have been asked to self-isolate as a result of those. So it's not a very frequent conversation yet, but it will become frequent, especially as numbers increase. So we've got to be ready with a response, and we've got to be reassuring public, because stress and anxiety are very powerful motivators when it comes to your actions. And if we don't manage them, we'll have the wrong actions, the wrong decisions being made, such as what we saw in the Grand Chancellor in Tasmania.
Just briefly, do you feel like now, in terms of stocks, you've addressed this a little earlier, you've got enough access to stocks and protections? Because that was clearly a concern for many GPs.
Look, I believe that the announcement of another 250,000 being released from the stockpile on the weekend is a good sign. Certainly the 54 million additional procurement to be coming in the next month or so is also another good initiative. We need to be very cognizant of the fact that clearly if we don't manage this advancing COVID-19 threat very well, we'll run out of any PPE. So we've got to manage the supply appropriately, but we need to have the stocks ready. And doctors at the front line, in certain circumstances, will run down to their last mask, their last glove, their last gown. And we can't have that if we're expected to be the frontline response.